Disclaimer. This program is intended for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The following program is intended for mature audience only.
Hi, I'm Dr. Kathy Swain Jones.
Hi, I'm Dr. Denise Joseph Zollicoffer.
Hi, and I'm Sonia Williams Finney.
And this is
Menopause Diaries, real talk, real stories.
Hello, everyone, and welcome back to Menopause Diaries, Real Talk, Real Stories. As you know, this is a program where we present ourselves to you on an open platter, and really we're talking real about menopause and how it affects our lives. And I am joined by my partners. Dr. Kathy, introduce yourself, please.
Hi, I'm Dr. Kathy Swain Jones. This is my voice.
And Sonia.
Hi. Hello, everyone. It's Sonia Finney.
Very good. And, we're going to talk today with another person who has just been really gracious enough to share her story and to tell us about her menopause journey. And hopefully what she shares today will be impactful to your life. And hopefully, we will continue this dialogue and that you will be able to see yourself, maybe have an aha moment. So without further ado, I'm going to bring on to the show now our guest, Tosha, who is joining us from Oregon. Welcome, Tosha.
Hi.
We're so glad that you joined us. Thank you for being willing to share your story. This is so important. And you were just gracious enough and you were like, I am ready to do this. So hopefully from this, someone's life will be impacted and hopefully we'll impact your life.
Okay, thank you.
Why don't you go ahead and start telling us a little bit about yourself and your menopause journey, and we will dissect it as much as we can and hopefully make it helpful for you.
Okay. Well, I'm Tosha. I'm 50 years old. I live out in Portland, Oregon. And my journey with menopause started around 48. I was kind of thrown off once I started having the sweats and the night sweats. It was really hard to determine when menopause for me was going to start because my mother had a hysterectomy earlier, so my providers could not pinpoint it if I was actually starting it or not. But I guess after some tests, some blood work kind of put me at the point of where I am at starting menopause. So, but it started off with the night sweats. I wake up in the middle of the night just drenched down in sweat, and it was it's been continuously around the same up until now. Every night between 1 and 3, I'm just up drenched in sweat, need some ice water just to kind of cool off, and then it goes away, and then my body temperature and everything goes back to normal. In the process of with going through that during this journey, I've been experiencing also just a lot of mood swings, anxiety. My sex drive has decreased tremendously, and I'm married, so it makes it hard for my husband and me to kind of interact. I also deal with, and it's so weird because I know my mom deals with the same thing. Like the nipple inching is really annoying, and it's constant, and it's like we still just don't know how to resolve that. But
Does your mom still have that now? Does she still struggle with that now?
Yeah, still struggles with that now.
Mm-hmm.
And we seem to have very similar facts as far as she wakes up at the same time like I do with the sweats. And one minute we're super hot, next minute we're freezing cold. And it's just been so weird how we're so connected in that.
Do you guys share the same medical problems at all? Do you have the same medical history?
Certain things we share. She never has had a PE or that's the only thing. But as far as like other things, we do kind of share the same. It'll be like we said, like gastric issues. We deal with the same thing.
You guys, for our listeners, can you clarify what PE is, just for some people that maybe? I was asking Kathy or Denise.
Yeah, a PE basically is the yeah, but I was thinking
pulmonary pulmonary embolism.
The lettering for pulmonary embolus. I was trying to think of acronym or whatever.
Yeah, but I was just
for pulmonary embolism, which is just basically a blood clot that lodges in the lungs and can be fatal. It's probably the most dangerous form of blood clots, and that makes your management even more difficult, because if when you were becoming perimenopausal or even menopausal, the easiest thing to do is say, hey, we'll try this little patch or try, and you can't do that. The other thing that's interesting about you is that your hot flash is basically where you want to probably rip your clothes off at night, and it's so severe, but you don't feel them in the daytime. So what I would suggest to you is that there's probably something else going on. A lot of times anytime we feel hot, we just associate that with hot flashes and nobody tells us anything different. But it's more probably of something going on with your adrenal gland. And the adrenal gland is our stress center. And our stress center can get burnt out through menopause. So maybe adrenal gland is basically two little organs that sit on our kidney and our back, and they basically help us out during stress. And so you had the pulmonary embolus during COVID, when if I get COVID on top of all of this, I could die. And pulmonary embolus is what takes women out, like just like that, before they can fall down on the bathroom floor and be dead before they can get to the hospital or before somebody can get into the room.
Right.
Then you maybe were perimenopausal and menopausal, but I think there may be an attack on your adrenal gland where it's burnout, because typically what makes me think there's more going on, because you're not stripping your clothes off during the day. You didn't say anything about having problems. And for a lot of women, they just think, if I'm hot and nobody tells me anything different, I think that's my menopause. The other thing is that, and we talk about this and learn this a lot, is that the root of a lot of things that affect our brain health, our mental health, comes from the gut. And so when you start having obvious gut issues, there could be imbalances that have that are created also from the gut, that have not been able to support your adrenal gland function. And now and that's something that has to be addressed, because what you'll find is, and you probably feel like this, is you're falling backwards downhill, down on the other side of the hill. And the further you get down that hill, the further you got to go back up to get on the other side of the hill. So the first thing I would think of is maybe there's some adrenal gland. Do you have any diabetes or anything? High blood pressure?
High blood pressure.
Okay.
That.
Okay. Was that later on in life, or since all of this is going on?
That all started with the PE.
Okay.
Okay.
What were the circumstances around the PE?
So what
were the circumstances? We see PEs a lot with women during pregnancy. So that would probably be one of the main times, when our estrogen, our hormone levels are high, and during pregnancy, and you get a blood clot in your lung. And so women die. A lot of the mortality is associated with women, during childbirth or shortly after. What do they think was the reason you had the PE at the time?
Well, it was first thought that it was due to my left leg. My foot kept swelling, just for no apparent reason. Um, I ended up having like a X-ray on it because they thought maybe I twisted it or something. But X-rays came back normal.
And they did the Doppler studies. They looked to see if there was something, and they
No.
didn't see it. Okay.
No, they didn't do Dopplers.
Okay.
And at that point, I ended up because one orthopedist thought it was probably a bone spur or something. She said she's seen in the ankle area. So they ended up putting me in a boot, and I think that's where everything kind of started. I was in a boot for 6 weeks. And so I'm just going along with it. The boot kept rubbing on the back of my calf, and then it started my calf to pain really bad. I was at work, and I kept wondering why I kept getting out of breath. And
I can't breathe right now. I can't breathe right now listening to this story.
I know, right?
Sonia probably doesn't even know very much about pulmonary embolus, but you see.
No, I do. No, I
progression
didn't
of-
say anything. My dad died from a pulmonary embolism. I didn't even say that.
Absolutely.
Yeah,
Well, and
yeah.
this is
But
one of the
everyone
things
missed it.
Yeah,
when we
Yeah.
talk
Yeah.
about also the disparities in.
Yeah.
It's probably
yeah,
not. There's no probably not when it comes to somebody potentially having a pulmonary embolus.
yeah, exactly.
Okay, let me take a couple breaths now. Okay, keep going. So you had the swelling and the pain.
oh, they
Then
thought
they immobilized the
Mhm.
joint in a boot.
In a
Then you
boot. I
started
thought it
having-
was just me, Kathy, because I'm sitting here like, did she just say they just put her foot in a boot? But I'm just listening.
Because
Okay,
pulmonary embolus also a lot of times, patients who travel a lot, who are on
Yeah.
airplanes, who
Yeah.
are immobilized or who've
Yeah.
had surgery,
Yeah.
back surgery, and they can't move. They're
Yeah.
at risk for pulmonary embolus.
Yeah.
Okay, so then you get in the boot, you start having calf pain.
yes.
DVT start in the calf. Deep venous thrombosis, the blood clot starts in the calf. Okay, I've caught my breath. Now, so where do we go from there?
Before I ended up going to the emergency room, I'll say like a few days ahead of that, I went back to see this orthopedist. They ended up saying they thought I had bursitis, so they gave me an injection in the hip.
Okay, can I just ask one question? Did anybody do a ultrasound of your leg during this time?
At the time, it was a CAT scan done and an X-ray,
but no ultrasound.
No,
Nope.
Girl.
Yes.
What, do you live in a small town?
That's what I was, because she said she lives in Portland, Oregon. That's
And
a big city.
And at the time, I was working for, so basically took the reign on this issue.
Well, and here's the thing: you can't say it, but I can say it.
Yeah.
What happens when you get to big corporate medicine like that? They have a certain formula. If you don't tick all these boxes, you can't have it. You know what I mean? And so the doctors a lot of times lose their clinical skills and suspicion because they've got to follow what says they're going to pay for it and when they're going to pay for it, and there's no negotiation. And so they push you all the way to the end. Ooh.
Yeah.
Okay. All right, keep going.
Kaiser Permanente. Okay.
Woo, okay.
Me and my husband ended up going on a little mini vacation to Vegas.
Okay. Oh, then you get on a plane.
I know.
No, this cannot be real.
I'm like, oh, well, it's just probably, we're not for sure, but the whole time in Vegas, my foot is just burning. Like,
Girl, can you believe it? Oh my gosh. I'm sorry.
Okay, keep going.
We get back on the plane, head back to Portland. By the time, I got here, my foot is just inflamed. And so I'm like, okay, I elevate it, do the normal things that they keep telling me to do. Went to work. At work, I'm out of breath. My pulse is like sky high. And so I'm like, why every time I take a couple of steps, I'm just out of breath. So after I got off, I decided to take myself to urgent care.
Okay.
And so I went into urgent care, and I saw the urgent care doctor. She was like, "You look flush." Like when she first looked, she was like, "You look flush." And she was like, "I'm gonna do a EKG." She sent me down to have an EKG. She, she did her like a physical exam. She checked my pulse, and she was like, "I need you to go over to the emergency room right away." She was like, "I'm calling an ambulance. I'm finna send you over to the emergency room." And I'm like, "Oh, no, wait a minute. I can take my stuff because I live, right by." She was like, "No, I can't do that. I have to send you over." So she sent me over to the emergency room. And because everything was under, at that time, they were letting, people in like that because of COVID.
They were screened. Oh yeah, you're not going to come paying for. You're not going to waste our money. Emergency.
It was during COVID.
Oh, was it COVID time also?
Yeah.
Okay.
Yeah.
Okay.
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 They had all the tents and stuff set outside.
Okay.
So I get in there. She had already, I guess, called and gave them reports. So they took me back to do a CT, and that's when they seen the PE. And
now you're limping in your boot and all of that. Okay. All right.
So they checked back up my calf because it was like, I told him it was very painful. So he told me, "Do not put back on that calf, that boot."
Exactly. Thank you.
Okay. So they admitted you.
No. Floors were COVID floors that they
Oh my
did
goodness.
not. He couldn't. He said the only way I could let you leave if I start you on medication right now, but you would have to follow up with your primary, and we have to refer you out to a hematologist. He was like, other than that, I'll have to admit you, but you're going to be on a COVID floor, which opens you up to, to catching COVID. So I was like,
yeah,
I'll start the medicine, send me home. And so got the medicine, and before I knew it, they had me an appointment with the anticoagulation clinic. Like after that, everything kind of went so fast.
Yeah.
So they put you on a blood thinner, and they give you okay.
So they started me on the blood thinner right away, and then I had to go to anticoagulation like every 2 to 3 days, so they can check my PT. My PT INR, I think that's what it is. PT.
Yeah.
I was doing that constantly until they ended up switching the medication. Once I got to see a hematologist, they switched the medication to a different one.
Yeah.
And when they decided they wanted to put me on warfarin, I had to go back. So the warfarin, and I was like, I can't function like that because I work. So trying to do anticoagulation and work, it was really hard. And
were you taking injections? The warfarin you were inject or
the warfarin
was tablet
pills. They had to, I guess, make sure that your blood range, your PT was a certain range.
So they didn't want to just keep you on the injectable to make it easier for you until
she's on the injectable.
Yeah. But I mean, that might have been an easier route than having her, because you know how you have to check the blood test with the warfarin, and if it's not, then you got to go up higher, then you got to come back and get it tested. That's a lot. A lot of times we used to just keep people in the hospital, get all that done, then send you home anticoagulated. Imagine her doing that as an outpatient.
Yes. Right. It was rough. And when I experienced side effects from the medication, and then it's like each time they wanted to change it, then I had to I ended up on the shot. I ended up taking Lovenox to bridge over to the other medication.
Yeah.
Why did they keep changing it? I'm sorry. Why were they? You weren't tolerating it, or you weren't responding, or what? Why did they keep changing it?
So the first one I was on was the Eliquis. My stomach started paining.
Okay.
So they must have had to, every time they felt like, okay, this is not getting us anywhere, they have to anticoagulate her again with the injection, start something else, then watch that till it, that's a lot.
That
Yeah.
is a lot.
Now, prior to this, so at this point, you were not having that night sweats and the waking up and the stomach issues. Was that going on now, or did it start shortly after that?
Prior to that, I was still dealing with the night sweats.
Okay. Did it start before all of that, or?
Yeah, that started before all of that.
Okay.
Once this part started, it seems like everything else kind of increased.
Yeah.
It was just it increased like times 10. And so I kind of figured, like, with what my body's going through, everything is going to get, thrown off balance a lot.
How long have you had stomach issues?
It really started, besides having just like IBS constipation.
When were you diagnosed with IBS constipation?
I would say about maybe 6 years ago.
Okay. And they put you on medication for that?
Yeah, which all the medication and the pain medication just really threw me off.
Were you having stress around that time as well? Stress at work, stress personally, stress with the kids?
Well, just the normal stress with the kids and getting married and everything. It was a lot going on at that particular time.
Yeah. Okay.
So you were newlywed at the time when you had this PE?
Yeah. That was like a wedding gift.
Okay.
Oh, wow.
Hey, honey.
Now, I know also that you said that they placed an IUD. What led up to them placing an IUD?
With being on the blood thinners, my cycle was so bad that it was just running out of me like water. And I couldn't function like that. Like, I couldn't function, especially when I'm at work, and it was just so bad, and it was like that's when I told you I was considering doing the hysterectomy, because it got so bad that it was pretty much, I couldn't control it. Like, I couldn't control it with just like a normal pad or a tampon. And so
did they ever recommend endometrial ablation?
Nope, she never recommended it, but I worked for a gynecologist and he recommended it.
Because here's the thing. When we start trying to put all of your stuff together, there's a common theme of more going on than just menopause.
Right.
And that, one thing is aggravating another system. And then when you got around perimenopause, it just, everything went to, your body just lost it. But if you start trying to say, okay, because one of the things you want to do is the IUD, the Mirena IUD, the progesterone can take your sex drive away, usually 2 years. Once you're in it, about around year 2, year 3, your sex drive can be gone. Meaning, I love you, but just don't touch me. Like, you just don't feel anything. It can also cause dryness, because it can, when you're perimenopausal and menopausal, or if you've been on it longer than 5 years. So you were perimenopausal, menopausal, had the IUD in, and then you started having the dryness and you started having the decreased sex drive, and it was really very difficult to kind of figure out. So one of the thoughts would be, okay, hey, maybe if, especially now, to get that IUD out, the endometrial ablation is a 2-minute procedure. It's a balloon that goes in, 2 minutes, you're done, and you're finished. And I read that your fibroids were small, so it really wasn't the fibroids that were the issue. It just, if you're a candidate for it, that might be one way, because a lot of times what we want to do is see what's shouldn't be there, remove that, and see if you regain function by just getting the IUD out. And I think you probably at some point need to address the issues with your tummy. One of the things that I do, I'm a board certified gynecologist, but I also do functional medicine. I do free consults to kind of, so that maybe we can talk a little bit, off of here, and I'll give you the contact information so that you and I can really discuss what repairing you from all the way back on the things that are dictating how you feel now and feel in the future. There's certainly some things that we can recommend that will help you feel better today and help you start, gaining some of your moisture back. But if the Paragard is causing it, then there's only so much you can do. So I think all of that needs to kind of be unpacked as well. And then I will say also that the waking up at night, the 3 a.m., that's adrenal gland. Our adrenal gland activate. It's supposed to be at its lowest when you go to sleep, and then it rises with the sunrise. So usually around 6 a.m. it rises, and that's when we're supposed to wake up and feel like, oh, I'm ready to get up. Yours is rising at 3 a.m. And so you wake up like you should be awake, but you're dead tired. And when you do that day after day after day, then you blow out any function of your adrenal gland. It's not going to work. You're going to feel nervous all the time, anxious, overwhelmed, and then all of the things that, I think probably your gut, at some point there were some imbalances there earlier on. So and this is a good story because a lot of women, this is what happens, is that once you get to, we say this almost at every patient, is that you have all these things that you've kind of lived with and you can kind of hide a little bit, or I'm okay. But there's a point where you got to decide, I need to feel better. I can't, your IBS-C, your IBS constipation and your IBS diarrhea, those can be fixed. And when you get on a prescription, that's not fixing it. That's just relieving your symptoms. That can actually be rebalanced, but that's what functional medicine does, where conventional medicine doesn't. And so that's when people decide that everybody has to get to that point where they basically say, do I want to keep taking this prescription, or do I want to really figure out how to heal myself so my body starts, because everything plays off the other thing. So when your gut is unhealthy, your brain is unhealthy, and then you're setting yourself up for stuff like dementia and Alzheimer's, heart disease, diabetes, insulin resistant. Your body has to sleep to reset itself. So all of the things that your body needs to do to be normal, it can't. So I can't wait to get you alone, one-on-one, get this figured out.
Yes. Tosha, is she ringing your doorbell, as my pastor would say?
Yes. Basically, is she on your doorstep?
Well, let's talk about what she could do now for what I'd like to see you do, and I'm going to make some recommendations to you when we talk one-on-one, is to because two things can, first of all, the IUD, I think you really need to have a conversation with your provider on, hey, am I a candidate for this endometrial ablation? Maybe I'm even menopausal and I don't even need the IUD anymore. And because that could take the suppression from, that could help some of the dryness and some of your sex drive. And then there's some natural things that you could do to help, because of all that you've been through, there's got to be some underlying anxiety that even when it now comes to intimacy, you already get this block that comes over you that's actually coming from not even from a level of desire. You can't even feel it because it's almost like a performance anxiety. You know what I mean? And then you start feeling misunderstood. Then he doesn't understand. The first thing that they say is, oh, you're not attracted to me.
Yes.
I'm suffering here. And so then you guys are at opposite ends. Your back is facing this way, his back is facing that way. And it really is because you don't understand what's going on, and they certainly can't. And so I think, maybe doing something to help with anxiety naturally, and then seeing about the IUD if that still needs to be in there. And if you're not menopausal, maybe considering the ablation, and then really getting at your gut health to because if a person could only do one thing, they get a free ticket to do one thing in their body, that would be to get that gut health, because it controls our brain. It controls really all of our longevity markers.
Exactly.
So, I was going to say, So one of the things for the dryness, you're limited when it comes to that. We were talking about taking maybe the IUD out, but you can add some moisture right now by using getting some pure, unrefined organic coconut oil, and you can get that from Whole Foods. So you get the little jar. And then what you would want to do, and believe me, I have women who use this, and I've taught them how to make the suppositories. And when you use it regularly, I have women who it's hard to tell if they're on hormone replacement or if they're, if it's like if somebody has been doing the coconut oil treatment, the level of hydration. So we don't want just, we don't want this a covering of the lining of the vagina. We want something to penetrate through the tissue and bring moisture from behind, and so that we feel hydrated and not just moisturized. But you would get the coconut oil, and all you have to do is just like put it in a bowl, scoop it out, put it in a bowl, melt it in the microwave, and you order some suppository trays from Amazon. Okay. And you pour them in you pour the coconut oil in the suppositories, put them in the refrigerator. A lot of times I tell patients to get just like a Tupperware tube that can hold a couple suppository trays. You can tap coconut oil to your labia and all where you feel dry. You don't have to scoop it. You just tap, 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 tap. And you would do that maybe every night for 7 to 10 nights. You'll know, because when you wipe yourself, when you bathe, you'll feel like your old self again. Like, oh my gosh. And then you make the suppositories, and you can insert one, not just right here, into the vagina, just with your finger, the coconut oil suppositories every night for 7 nights. And then you can do it twice a week, and then usually, typically after about 2 weeks, you will start having natural moisture on the inside, and that where the pain with having relations will be gone. It is not something that you could use once and then 3 months later use it again. You would have to use it on a regular basis, so that when you decided to be intimate again, that at least the pain and that's not a problem.
Okay.
Yeah, and it actually works, because I actually had Mirena, and I did it 3 times back to back. I loved it, never had a period, but on the downside, I don't even know when I started menopause, because by the time I came out, I think I had already started going through the process. But then the other thing that I just learned recently, through one of these, podcast sessions, is that I didn't realize how much it depleted me of, the hormones. And so when I came out, I was so depleted. So that's something that, I mean, I wasn't told as, could potentially be a side effect, but at the time I was just looking for something that was easy. I didn't want to take the pill for various reasons. But yeah, so that's something I would definitely recommend. I do the coconut oil. I use it. And like she said, I don't even use it. I use it on the outside. I've done some other things, but yeah, definitely it works on the outside. I keep it right on the side of my bed. And I actually found some like it's natural, but it's in a little, it's a bottle actually. So
is it a liquid?
It's not a liquid.
It's a paste like.
Yeah, it's thick.
Yeah. Yeah.
So when I squirt a little bit out on my finger and just do it, yep. And
as long as it's pure, unrefined, organic, no nothing in it. But a real simple one to get is just the one from Whole Foods. Yeah. And then you just tap on the top of it, just where you can feel it on your fingers, and then just tap it everywhere. Because do you, like, even when you wipe yourself, do you feel kind of dry sometimes? Like you've got to almost pat or if you wash too fast,
it hurts. It's painful. It's painful. Yeah.
So that is something that you could get started with now. Okay. Taking the IUD out. Also, there are some there's some, and here's the other thing too about sex drive and where functional medicine really is strong, is that most people don't know, they think we just have one estrogen. We actually have 3 forms of estrogen: a weak one, a middle one, and a strong one. And a lot of times, if you are manufacturing, metabolizing, and excreting the right amount of estrogen, then you won't really feel any hot flashes. But I don't think that yours is menopausal. I think yours is adrenal gland is adrenal. But if it was, just balancing your microbiome allows you to then, it brings back the balance to you still creating the strong estrogen at a lower dose, but enough that would not cause you to have the estrogen side effects. It might not necessarily be the cause of what's waking you up, the hotness at night, but it could help with your vaginal and vulvar health and with your libido as well, is to make sure that those estrogens are balanced. And to think about, if you think about the investment of healing your microbiome and your gut health, if that allowed you to decrease your risk profile on other diseases and disorders and imbalances and your future health, it really is something to take a look at, especially if for somebody who doesn't want to be on medication and have things escalate. It's really that easy. Then you have to go ask yourself, well, this doctor knows that. Why don't these other doctors know that? Because everybody would learn how to heal themselves naturally. And what profit is there in there for if you weren't sick?
Mm-hmm.
I hate to say that, but that's how they make their money, is for you to come for regular visits. And then once you start having a problem, you're coming more, you're going to radiology, you're doing all these things. And it's not a nice thing to say, but I did it for 30 years. And that's because I can't answer why they don't have access to the testing that we do.
Well, that boy, we've given you a lot to think about, right, Shauna?
A lot. Oh,
yeah.
But
do you have a question?
Yeah. So with the IUD, because I recently, like I told you, I've been having the breakthrough bleeding.
Mm-hmm.
Does that mean that the IUD is kind of is not working for me?
How long have you had the IUD?
Now it's 2, 3, 4, just about 3 years.
So yeah, so the IUD, it still works for contraception, but for somebody who has, I mean, did they do a biopsy on you when you had your IUD put in?
Yes.
Okay, and the biopsy was normal, or did it show an overgrowth of tissue, a thickness?
It was normal.
Okay, so yeah, the IUD still could be, I mean, the breakthrough bleeding could be coming from the adrenal glands not being able to manage and maintain your stress. So this could be like a breakthrough bleeding from like a stress breakthrough bleeding that anybody would get. So it would suggest that you're not menopausal yet. It would suggest that you're not menopausal yet. And what that would mean is that if you had it out and if it was paid for 100%, it's a 2-minute procedure. If you could have it done just to go into that endometrial ablation, so you don't have to worry about that back and forth spotting and all of that. So you want to go on it. You still want to go in and get that checked to make sure you don't have a polyp, to make sure there's nothing else new going on. But if all of that's normal, it might be, just well, hey, I'm thinking about getting it out and maybe having the ablation done.
Yeah. And that's one of the things I forgot to mention. There were polyps that she had took out during that procedure when she was shaving down the fibroids.
Yeah, and the polyps, the polyps and your history. So the polyps show at some point that there was some estrogen excess. So which would again support the fact that you had a DVT. Another thing about you getting your gut health together, if there's an imbalance that no one really can see, you'd want to know that so that can be fixed so that you don't ever have to face this again. Because the thing is, even though you have the IUD, we still make some form of hormone up till about the age of 65.
Okay. So this is a lot to unpack, and thank you, Dr. Kathy, for trying to do that, because she has a very rich history, and which is one of the reasons why we were really happy to bring her on the podcast, because there are so many people who have other things going on that will impact them as they go into menopause and going through menopause. But you mentioned about the gut health, and one of the things that she really talked about was the fact that she has IBS and constipation and all that bacteria that's going on in the gut, and maybe just being able to take care of some of that will help some of her symptoms.
Well, I mean, it's statistically, we know that to be true. It is not something that is talked about in a conventional medicine setting, because again, at the end of the day, everyone learned to heal them. Everything starts in the gut. If everyone learned to heal themselves from the gut, who would be admitted with diseases, disorders, and imbalances? Who would be going to the pharmacy? Pharmaceutical companies are, one of the biggest, the richest industries in our country. So who would be using big pharma? And so these things, when you see it, because, a lot of doctors, especially now, come right out of medical school, go right into a corporate setting. They don't know anything about this. And so for patients to know, a lot of patients accept the diagnosis and they don't move any further from that. They basically give up or give into, this is my health status. And what I'm saying is that functional medicine can meet you where you are and take you as far back, or because every cell in our body and in our organs rejuvenate themselves over and over. It's just that if we don't remove the culprit of the damage, you'll never see the rejuvenation of that. So let's just say what I would say to you is IBS-C, so that's irritable bowel syndrome with constipation, and IBS-D, irritable bowel with diarrhea, there is a root cause. When you go to the doctor, they rule out that you don't have pathogens. You don't have something that if we don't treat it, it's going to kill you. That type of bacteria. But they don't check for your normal bacteria that's supposed to protect you to see if it's doing what it's supposed to do. And then they don't check for the normal pathogens that they don't test for if they're overgrown. Their tests don't check that. And so many people, but they have medication now that that treat the IBS. And I saw a commercial the other day, I think it was Linzess or one of those, that said, now you can heal your IBS. It's not healing your IBS, it's treating your IBS symptoms. So it can help decrease your bouts of diarrhea or constipation, but you haven't treated the underlying cause. And when you deal with the microbiome, if it's causing you to have, brain fog, anxiety, all of those things can be settled by healing the microbiome. And so with you, a lot of like, if you concentrated on that gut health, your body will begin to heal itself. And then all of the things that as you begin to feel healthier, you're able to do more things and do the next thing to help you be even more healthier. But until those things get addressed, it's just adding one medication on top of the next medication. And that's what we want to really stop. That is what my mission is just to help patients understand that there is a way to unfold and heal your body, and so that you can ideally come off of the medications and it works as well as you put into it.
Yeah. You're absolutely right, because gut health, true Linzess, and it's still, the problem is still there. Our bloating. Oh, well, let's try some Metamucil or some Benny Fibers, try that daily. My stomach is painy. Let's put you on cyclamine, and you'll take this every day. So it's like, they're not getting to the root problem. They're covering it up. Are just
and guessing. And they're guessing. And every time you take a medication and take an antibiotic, you're only making the imbalance worse. And so with functional medicine, the labs that we do actually look at all of your good bacteria, all of your good bacteria, all of the bad bacteria, antibodies, and then your gut lining health. And then we address, each person has a different, there's no, everybody should do this. Oh, you're having this, you should take that. You're only guessing. With functional medicine, we can then pinpoint, hey, we need to regrow this, we need to get rid of this, and we need to heal the lining of your gut. And then once you do, and it heals, it works. I had my own health problems early on, and that's how I found functional medicine. And as a doctor, I was faced with things that, and I went to the specialist and they were like, well, here's a medication. I'm like, no, 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 but why do I have this? Well, it's probably genetic and, this, that, and they never had any answers. And I went and researched it. And then when I found this beautiful thing called functional medicine and realized that, it took me a while because I was in private practice for a long time, but it took me a while to understand that it's the corporate system of medicine is just not a part of how they want to heal. I don't want you to be sick. I don't want you to struggle with those problems. And so sometimes I come across passionate or angry because you don't have to be sick. You don't have to struggle, but you do have to do the process. And it should be, to me, part of mainstream medication, mainstream healthcare.
Yeah, I totally agree.
You actually, Tosha, present a very complex case in the sense that you have so many things going on. And like Dr. Kathy said, going into your local doctor, they don't have the time or the knowledge or the wherewithal to manage everything because, there's so much going on, and if, just to kind of recap, you've got the gut health, you've got the bleeding, you've got the IUD, you've got the sexual stuff, you've got the night sweats, which you probably have never heard about.
Yeah.
Adrenal gland. Yeah. You probably never heard that could be, part of it. So there's a lot going on. And I don't want you to think that this is going to be a 5-minute fix because it's not. We have so many things about you that would need to be focused on and worked on to help you get to your best life, living your best life, and enjoying your husband and having good healthy sexual relations and going through menopause, victorious.
So Denise, help me with this. So let's look at her problem. So she would definitely see the gynecologist. She would see the GI doctor. She would see endocrinology. She would see anybody else you can think of. And then she would probably see all of the specialists of those.
Right.
So you got your basic gynecologist. Then they would send her to the hormone specialist. She would go to all of these. And the problem becomes everybody's just looking at their one little area and trying to figure out what. And even if they give you something to help the symptoms of that area, it didn't fix the root cause of the problem.
Yeah, I totally agree. And she has so much going on that I think it's going to be, let's isolate and work on one thing at a time. Because if you, just so you can start getting the fix as you go along. And I just want to say, Kathy, you talked about, was the embolization you said? What did you say?
No, the endometrial ablation.
Endometrial ablation. And just to put a little bit more to that, the endometrial ablation is geared at really taking down some of the lining of the uterus that we would bleed out when we have a normal menses. So just that you kind of put a heat in, scar it so that you're not bleeding as much. And just so that for our listeners who may be wondering what that's about. Would you want to add anything else?
The way I explain it is it's like if somebody burnt the hair off your head and your scalp healed in a scar. You can't grow hair anymore, but you think the same, you feel the same. You just can't generate the lining of the uterus that bleeds. So, and it's a 2-minute procedure. You're in and out. When I was in private practice, I used to do 5 or 6 of them every Friday. Boom, boom, boom,
right.
As an alternative to a hysterectomy or being on medication.
Yeah.
So what I would like is, I would like, Will, and I'll send it to you, to your email, where, you can just make an appointment and let's just chat and see what, we can, some more one-on-one suggestions to help you because, I want to see you get better.
Thank you.
Yeah. Just because you've got so much going on and, I think just being able to help you coordinate everything and help you to get all the care you need in a stepwise approach that works for you. Because we realize you're still a working woman, you're still a mom, you're still a wife, you know.
Right. And
I think you're striving for just to feel good, to not wake up in the middle of the night, to feel rested during the day, to get your intimacy back, and just to feel like there's not something else creeping behind that's going to jump you this year.
Exactly.
Or this upcoming year. Yeah. So
yeah, some balance, some type of balance that goes on. So
How old are your kids?
I have a 31-year-old, and
the youngest one is how old?
25.
Oh, okay.
Wow.
Yeah. But you've got a lot going on, Tosha. You know, Tosha, I want to thank you because when you and I talked, and you were so willing to come on the program and so open about the issues that you're dealing with, and I can't help but think that there are other people out there who are dealing with some of the exact same issues that you're dealing with, and having just not being heard, not being evaluated properly, especially about the PE, and everyone's kind of putting a band-aid on on their segment without kind of looking at you as a total person. And I'm glad that you're able to now connect with Dr. Kathy, and you'll go in for your free consultation, and hopefully that will help you somewhat. I hope so.
Just remember, I was telling you as well, I had signed up for a consultation with that Mid-D Health.
Mm-hmm.
Mm-hmm.
They're trying to promote this product for menopause where you give yourself some type of injection that I was having you look into. So now I can't not do that.
What injection were they trying to? Was it for weight loss?
What's that about? Yeah, what kind of injection?
Yeah, it said to help with menopause. If you're struggling with bloating, hot flashes, it was some injection, but they wanted you to have a consultation with one of their clinicians to kind of go over your symptoms. And so when Denise was talking to me about it, I was like, I just signed up for this thing, and I gave her the website, and it's like, wait a minute, I think we'll be able to kind of guide.
Yeah, I mean, typically those places are great if it's the right place for you. They're more of a sort of an in and out, sort of a low complexity. For your issues, you would get better care staying in the hospital system and going there. This is more, I mean, you might get a 10. They're really not designed to, and you can go on and see, do that consultation. You can go on and see, but I'm not sure if sometimes when they get big like that, they still sort of operate the way like a corporate hospital would, and they will, the limited time, you have a limited time with the provider. They may be once a month or once every 3 months, or you then, you see the provider, and then you have, it may not be the physician. And again, it's still little bits of care.
But they're only going to address her menopause stuff, though. You're saying she has some other things that she may want to take a look at, though, too, right? Kathy? So they would only.
I don't know if they do functional medicine.
That's what I'm saying. I believe that they would only. I believe, because I know there's several of them out there, but I believe they would only. But if she in fact has something else going on, outside of the menopause stuff, then she still would need to come back. So
they really work well. Let's just say for the 50-year-old who never really have any problems, and now she's menopausal and she's having hot flash. Because I don't even think your a lot of your stuff is menopause. I think it's adrenal gland and your GI system. And sometimes people get in, and then they get into, and then they start doing their treatments, and it still doesn't really treat the root cause of the problem because it's really not menopause.
Yeah.
So, and what we'll do is we'll talk one-on-one and work it out and see if, what options, and then you can kind of look at, functional medicine really, again, just go to the root, and then everything responds to treating the root of whatever your imbalance. And it's specifically, it will help with your perimenopause and menopause. And sometimes those programs are just helping with your menopause causal symptoms, but not everything else. And that's what Sonia is trying to say. So I say see as many people as you can so that you see the thing is that you have options on getting better. And, that's the most important thing.
Well, wait, are you still seeing those same doctors that you were seeing back then, or have you switched doctors? I'm just curious.
I actually switched my primary care. I switched my primary care. I ended up I was looking for a doctor that was more leaning towards natural medicine because I got tired of getting pushed on medicine.
Well, you found one right here.
I only asked that because I think that for me, I've had there's so many different symptoms, menopause symptoms, and we're hearing that you might not even be there, but I was just going to say that you have to be your own advocate and be your own cheerleader, and if you feel like you're not being heard, I know sometimes we get complacent and get comfortable because we've been seeing a doctor for so long, and sometimes we don't like change, and change is hard. But when it comes to your health, because you only get one life, so I was going to say, I strongly encourage you to find somebody that is going to hear you and listen to you. I think that's very important. So that was the only reason I was asking. So, and if you feel like you're not being heard, then, seriously, I know sometimes it's a headache, it's an inconvenience. My daughter, I was just telling her, you need to find another doctor. Oh, Mom, I got to go on the list and I got to find, but sometimes it's worth it. If your health is important, so.
Yeah. And I think, if this episode just helped someone with understanding that if I'm not being heard and I don't want to be on this, cycle, that you might have to find another one or two, because once somebody hears you, they're able to fix it.
Exactly.
Just the little, okay, here's this, go on to somebody else. And when somebody's really not listening, or that they don't have anything else to add, you're just doing the same thing over every year. And when you get sick, so when they finally diagnosed the PE, you had excellent care. That's when they shine. We want to stop that before we even diagnosed it before you even got there on, that they should have intervened a lot earlier on. But a lot of that also comes from the chronic inflammation that's in the body when the gut is unhealthy, causes inflammation in your blood vessels that then predispose you to blood clots. So even that is treated through treating the root cause of the problem.
Yeah.
They don't want you to hear it because everybody would learn how to heal themselves and they'd start raising their children with the things that they learn. So my patients typically, they all look at it like this. My daughter's struggling with the same thing. And they realize, so whatever you're doing for me, I'm going to do this for my kids. And you begin to raise your children and your grandchildren in a different way when you start learning that really our environment, how we live, the level of stress that we carry, and they all tell us it's normal because nobody spends 45 minutes talking to us about that and and then telling us how we need to unwind that. They spend 15 minutes checking us in and then 5 minutes writing the prescription.
Yeah, that I totally agree.
And then it's 6 minutes the next year because you're getting another prescription. And then a year later, you might get 10 minutes because now you got 5 prescriptions. And then when you go in the hospital, that's when the best come out. The important doctors with the white coats up to here, and this person saved your life, but it doesn't have to be. Who's more important, the one that saves your life or the one that prevents you from ever being in that hospital?
Exactly. That is
the one who called the ambulance for you is the one.
Like, no.
Well, that was an angel. God said, girl, go to this emergency room. She's going to be sitting there waiting for you. She's going to say, I don't want to hear it. Get over there.
Yeah.
Wow. Wow.
Well, Tosha, thank you. Do you want to say anything in closing, Tosha? Because we've come to the end of our podcast.
And I was just like, great. I really appreciate the information. It's given me a lot to think about and to kind of reevaluate everything that has been happening, and just like she said, get to the root of the problem and not cover it up. And you're talking to someone who started off not taking any medications until now I take more medications than almost an 88-year-old woman. It's like, I'm like, this is not right. And yeah, I just want to really get to the bottom of it.
Well, we're going to get to the bottom of it.
Yeah, exactly.
And I did want to say that, and I'm going to send you my contact information but any of the listeners who are listening who say, "Ooh, that's me too." I've got, like, I've never taken medication my whole life, and now I've got 3 prescriptions, and they're talking about more, and I've got another specialist, and I don't want this. I don't choose this. You can contact me. My website is womenshormonewellness.com. And there you'll have all the information about me, what I do, why I do it, and then you can make a free consultation appointment with me, and that's womenshormonewellness.com. My name is Dr. Kathy Swain Jones. My Instagram is Dr.Kathy Jones, so you can find me in any of those places. And in my Instagram, you can just, there's links in the bio to the website and all of that. And this is, I've chosen to do it this way because I feel like I can have more impact on helping women across the nation, because this word has to get out, is that we don't, yes, be there for me if the lady is sending me to the emergency room because I'm about to die, but somebody help me not get there.
Exactly.
And it's also teach one, do one. One of my expectations is, and especially for us as African-American women, this is mission driven for me, because we do lag in healthcare. We're sometimes don't get all of the information. And it's important that I teach people at a level that you can then teach your sister. You can then teach or bring awareness to your family and your friends. And then once you bring that awareness, they bring awareness to family. And that's how, a movement can spread. And then before you know it, in our kids' generation, they don't have to live health-wise like we live.
Dr. Kathy, thank you so much, because you really summed up why we do these podcasts. I mean, we really want to make an impact on our generation, for one thing, but also on our African-American women or women of color, because, we struggle with so many things. And there's always the issue of health disparity and all that. And
she could have died from a PE that we diagnosed from the first time she opened her mouth. They didn't even warn her or were suspicious, and she got on a plane in a boot.
Yep. I totally, and that's why I'm so glad she came on and shared her story, because it does make an impact to hear that that's something that she was going through. Somebody else out there maybe going through exactly that. So I think that's just one of the values of having this podcast, and why we are so committed to doing it.
Yeah.
But thank you so much for joining us. And being willing to talk about your story and being so open. We really appreciate it. Ladies and gentlemen, because we hope there's some gentlemen out there listening, so you can, pass this on to your mother, your wives, your girlfriend. But we are so glad that you've joined us for another Menopause Diaries, Real Talk, Real Stories. We hope you'll join us next time, and we look forward to being with you. Take care. Bye-bye.
Bye-bye. I will send the link to your email, and you can just use that link and let's just chat and see where you are. Okay. And just figure out what can be some first initial steps on trying to get you on the path that you want to be.
Okay, sounds good to me.
Yay.
All right.
God has a plan for you, baby, because you got on an airplane with a boot, blood clot in your leg, and you made it back. God has work for you to do. Your marriage can be restored, but we've got to get your health together. That's what's killing you.
Mm-hmm.
Okay. All right. Bottom of my heart, I'll look for you, and then we'll talk on the other side.
Okay, sounds good.
All right, my love.
All right, take care. Bye-bye.
Bye-bye.
This is
Menopause Diaries, real talk, real stories.
Thanks for listening. Let's thrive together through every
Hot flash,
mood swing and sleepless night. Don't forget to like, share, and subscribe to Menopause Diaries, Real Talk, Real Stories. If you have questions or want to share your story or would like to be a guest, visit us on Instagram at Menopause Diaries Podcast. Let us start a conversation and navigate this journey together.